An image can signal who deserves empathy and who does not, even before context is established. The response can feel humane and immediate. It can also be directed. Hi, I'm Seth. This is episode 2 of the Visual Propaganda Toolkit. In each episode, I isolate one visual tactic, identify 3 recurring cues, and end with a counter tool you can apply immediately. This episode focuses on victim imagery. In coverage of crisis and harm, form often gets ahead of explanation. Victim imagery is the visual construction of suffering in ways that guide where empathy flows. The harm can be real, attention to it is structured by framing. Across coverage, that structuring tends to rely on repeatable cues. Across repeated choices of selection, proximity, and emphasis, viewers are steered towards stable readings of who appears innocent, who appears responsible, and whose pain appears urgent. This episode draws on visual semiotics, framing theory, and research on humanitarian representation. In framing terms, selection and salience determine which problem becomes visible and whose suffering is foregrounded. Across media systems, conventions circulate faster than context. Research on humanitarian photography shows that recurring tropes, children, mothers, medical workers, ruins, operate as shorthand for innocence and urgency. Across time and place, images can organize moral response before explanation enters. This is a civic media literacy series built on a simple premise. Suffering is real, and images influence what we notice and what we conclude. The toolkit examines visual techniques across contexts to help show automatic judgments. The examples are shown to analyze form and convention. As in the previous episode, the focus remains on form. The images function as cases for close reading. Their inclusion does not assert propaganda, staging, or intent. They are treated as visual constructions to show how familiar conventions organize attention and channel empathy, regardless of motive. Take 2 photographs. In one, a child sits in dust, stunned, face open to the camera. In another, an elderly woman cries beside a younger girl in a domestic scene. Different places, different years. The emotional effect blends the same. This is innocence coding. Certain figures act as near universal empathy triggers. Children, elderly people, visibly injured civilians, caregivers. When they sit at the center of the frame, interpretation narrows. Viewers move fast toward moral clarity. Context drops away. Details reinforce it. School uniforms, hospital beds, domestic interiors, toys and rubble. These cues anchor the subject in everyday life and position them as a non-participant. The suffering reads as undeserved because the scene marks the person as someone outside combat and outside decision-making. Expression and gaze intensify it. Tears, shock, blank stares, visible fragility. A child looking straight into the lens collapses distance and turns a public event into a personal encounter. Zoom out for a moment. Across repeated coverage, if one side is consistently shown through children and families, while the other appears mainly as armed figures, innocence becomes unevenly assigned. Empathy tends to follow that pattern. Viewers are guided towards certain emotional alignments. When you encounter an image of suffering, pause on what is signaling innocence. Age, clothing, posture, setting, gaze. Notice how these cues shape your response. Then consider which groups rarely appear with those same signals and what that absence does over time. An image can move you toward urgency before you register what exactly you are being asked to feel. Close-up images of wounded bodies, grieving faces, or damaged homes intensify urgency. The viewer is positioned inside the scene where pain is readable at the level of skin, expression, and gesture. In coverage of wars, bombings, and natural disasters, news photography frequently turns to tight frames of survivors, families at funerals, or people standing inside ruined apartments. Images where faces and hands dominate and surrounding context fades. Distant or elevated views communicate scale while reducing personal identification. Satellite imagery, aerial photographs, and wide establishing shots used by major outlets render destruction as geography. Neighborhoods flattened, roads severed, camps expanding. The viewer understands extent, individual bodies are harder to locate. Scale works in 2 directions. The 2015 photograph of Alan Kurdi, widely republished after distribution by Turkish media, condensed the refugee crisis into one child on a shoreline. Wide shots of migration, columns along highways, crowds at border crossings, camps photographed from above translate suffering into mass. Each form documents reality. The framing shifts whether empathy lands as intimate or statistical. Repetition intensifies the effect. When one crisis is repeatedly visualized through victim imagery, close embodied suffering, faces in tears, injured bodies, funerals, and another is repeatedly rendered through smoke plumes, infrastructure damage, maps, or officials at podiums, audiences can end up tracking urgency through visibility rather than through verified scale of harm. Over time, the difference in what counts as the story becomes a pattern. One event is personhood, the other is terrain. In visual terms, this intersects with salience and modality. What is large in the frame, sharp and centrally placed, reads as immediate and emotionally real. What is distant, generalized, or presented as diagram and surface carries less effective weight. Distance becomes an allocation device. It distributes who gets to be seen as a victim and who becomes an outcome. Images of victims can isolate suffering from cause. Across crises, this pulls attention from causality toward aftermath. Victim imagery often arrives without perpetrators, weapons, or the chain of action that produced the scene. A destroyed building shown without visible agents becomes damage as fact. A grieving family shown without situating context becomes sorrow as story, with causality left outside the frame. The harm remains real. What changes is the viewer's pathway through it. The frame holds you in suffering while delaying questions of responsibility. Sometimes captions restore attribution by naming an actor, a weapon, or a sequence. Sometimes they do not, and the image invites the viewer to supply meaning from prior beliefs. Barthes called this anchorage. Text narrows an image's interpretive range. Without anchoring, suffering images can circulate detached from origin, then be reused to support different, even opposing narratives. When one side's victims are routinely shown with clear attribution and another's are routinely shown without visible cause, responsibility becomes uneven at the level of form. The counter tool for victim imagery is a three-step pause. First, let yourself feel it. Then separate empathy from inference. Take the emotional hit as real, but hold off on conclusions about blame until you have verified information. Second, name what's doing the work. Is the image intensifying empathy through innocence coding, proximity, repetition, or context removal? Third, zoom out from the single frame. Compare sets, not singles, across different outlets and days. Who keeps appearing as a child, a parent, a patient? Who shows up as smoke, rubble, and maps? Who is rarely granted a face? Victim imagery is powerful because it mobilizes moral urgency. That urgency can support real care and response. It can also flatten complex conflicts into a simple moral shortcut. In the next episode, we move to repetition, how recurrent scenarios, layouts, and keywords build up over time and start to define what feels normal. If you come across a strong image of suffering this week, try naming the cue before you share it.